The researchers tell us a number of interesting things at this point. One thing that they estimate is that in the United States this year, some 41,000 more cancer diagnoses will take place because of the presence of overweight or obesity than would otherwise have occurred. Another view into that same kind of data is that of the women dying in the United States of cancer this year, some 20% or so are due to the presence of obesity or overweight. So there appears statistically to be a link between these two events. And indeed, during the same time frame that we were talking about just then, there has been an increasing risk of overweight and obesity in the United States. So these things seem to be going together. If that's true, what mechanism might be responsible for that? Well, cancer cells, when they grow in the body, are growing under this drive to be growing. And one of the factors that leads to the growth of cells in the body is IGF. IGF stands for insulin-like growth factor. It's a messenger that attaches to the surface of a cell, and in that receptor for IGF, it releases the message telling that cell to proliferate and to grow. And so these growth factors are part of the drive that have these abnormal cells getting that message. These abnormal cells then take that message and use it to grow. Well, insulin-like growth factor is referring to the fact that those growth factors have a significant similarity to the structure of insulin. They're different, obviously, but similar enough that what happens is that insulin, especially as levels of insulin begin to increase, have a potential to actually attach themselves to those same growth factor receptor sites by their similarity and to drive some of this proliferation like the IGF factor does. And so higher levels of insulin are associated with this tendency towards cell proliferation. And the concern is that high levels of insulin, in the presence particularly of insulin resistance, these levels become quite high, that may be a significant factor in the risk of cancer or the risk of overgrowth of cancer and the deaths that occur from it. And so the suggestion, and all of this is currently being researched, and as years pass, we'll be able to see more and more clearly what this data is really saying. But at this point, the suggestion, the implication, the probability is that these higher levels of insulin associated with the high intake of carbohydrate that we have in our diets is tipping the balance in the direction of more cancer and more risk from that. Now, the good news is that the diet that you're on actually leads to lower insulin levels. At the present time, probably quite low insulin levels in your body. But as you move forward in maintenance, the plan is that the moderate level of carbohydrate intake that you'll be participating in should set you up for some good things. Research will tell what that connection to cancer is, but at this point, it's appearing that there is a likely connection, and the diet that you're participating in is going to help set you up on the right track.